Bruising, of course, is just bleeding into the tissue. So all the bruising is bleeding from the capillaries and the small blood vessels. That's all it is, and you get this bruise. It goes, it's dark to begin with, kind of black and blue, and then it goes a bit yellow as it starts to clear as the blood is broken down. But again, remember, bruising is just a form of bleeding. Now, discharges. Discharges, when we're talking about discharges, we're normally talking about pus and pussy things like that. Well, it could be a serous discharge, it could be a clearer discharge. Now, discharges normally mean infection. But the thing about malignancy, if there's a tumour growing somewhere, whether it's a breast duct or in a respiratory passage, it alters the architecture of that structure and it can't clear its mucus and clear itself as it normally would. So infections become more likely. Infections are associated sometimes with discharge. So certainly want to check out, indicate infection, but tumours distort and block normal anatomy. That's the key point. So repeated chest infections, chronic cough, long-term cough should be checked out. Pus from the urethra should also be checked out, although normally it would be an infection. And pus from the nipple. Now this most commonly, of course, this occurs in women, but it can also occur in men. There can still be bleeding from the nipple or discharge from the nipple in men, and again it's an abnormal finding. And of course we've mentioned the vagina. Changes in bowel habits or bowel activity is another classic feature. Changes in defecation, that's just pooing, frequency, consistency of the feces, constipation, diarrhea for example, the shape, if the stool is a different shape, the colour, or if there's mucus associated with the shape. All of those can be abnormal. Again, normally, of course, not caused by cancers, but doctors can check this out really quite simply without too much difficulty. Colour, dark or pale. Now, obviously, if the stool is dark, that can be melena, that can be blood. But if stools become a very light colour, a clayey type colour, that can mean the bile's not getting into them because it's the bile that colours and deodorises the faeces. And if the pancreas, if there's a tumour growing in the pancreas, that can block the bile ducts. Many other causes, of course, but pale stools are always worth getting checked out. And again, a few simple blood tests can normally give you the diagnosis. Floaty stools could mean there's a lot of fat in them. And again, that could mean that the pancreatic digestive enzymes are not getting through to digest the fat. So floaty stools are abnormal. Dark urine can mean that the bile's not getting into the gut and can go into the urine. So dark urine again can be a symptom of pancreatic cancer. Abnormal bloating or swelling of the abdomen, again, is not normal, that should be checked. Persistent heartburn or indigestion. Now, some people get heartburn and indigestion for years. I mean, I have to take lansoprazole tablets myself sometimes just for a bit of esophageal regurgitation. But if it's new or it's changing, it could be a cancer in the esophagus or in the top of the stomach. The fundus of the stomach would be the most likely.
DoctorsToTrust.com. Please share this video with loved ones.